Today we are going to use claims, concerns and issues for our meeting. Sarah has agreed to facilitate us. Sarah, would you like feedback for your revalidation portfolio?
Yes, thank you. It'd be great to have some feedback.
Okay. Let's look at the ground rules.
One person to speak at a time. Use the contributor's own words when capturing comments. No discussion until everyone is heard.
Okay, what about the order?
Well, the claims come first, and these are the positive statements, followed by the concerns and issues. And issues are questions that anybody would ask.
Okay, what about the topic?
We're using it to think about how our team is working together to achieve the public health outcomes.
Let's start with the positive statements about our work.
Well, I've just had a really successful session with my health visitor student.
And breastfeeding rates have improved in our locality.
And all our one-year developmental reviews are up to date.
I have just used the emotional touchpoint tool with a new mom. It went well and she gave good feedback.
So, we've completed the claims part of this exercise. Okay, next. What are our concerns on how we're working together?
I'm really struggling with the new IT system. It's making it really difficult to get my work done.
I don't mind the system.
It's awful.
Have you tried phoning the IT help desk? They really help.
Yeah.
Sorry everyone. Can I bring you back to the ground rules? We're not discussing the points at this stage.
Sorry, we got a bit carried away.
Are there any other concerns?
I don't think we provide the right amount of support for our new members of staff and our students. I think everybody is so busy and now there's revalidation to worry about. I know that's a bit jumbled and I haven't said it very well, but I think it's a worry.
So let's clarify. There are two concerns. Support for students and new staff and help with revalidation.
Yeah, that's it.
Any other concerns?
Providing for families in need of greater support. We are identifying them, but further support for them is needed.
And hot desking means that sometimes finding somewhere to work can be difficult.
So, we've completed the concerns part of this exercise. Let's move on to issues. What questions are important to ask?
How can I manage my increasing workload?
And how can we deliver the core service to our growing population?
Thanks. Let's celebrate the claims now, before we theme the concerns and issues.
Yeah, there's a lot to celebrate and enjoy.
Looking at the concerns and issues, are there some that can be answered now?
Yes, the question about how we deliver the core service. All staff must prioritize core contact and signpost families with difficult needs to other support services.
Thanks for that, that's really clear. Does that answer the question for everyone?
Yes, for now. Hopefully soon we'll be able to offer even more packages of care.
So, looking at the concerns and issues then, there seems to be three themes. 1, support with the new IT system. 2, preceptorship for students and new staff. And 3, support for families needing additional help. Let's now agree what is in our total control, partial control, and what is out of our control.
Partial control, I think.
Although I think the support of our new staff and students is totally within our control. The sort of culture that we create will make a big difference as to whether we keep them.
So we all agree? It is important to look at this retention issue in more depth though.
Yes, but let's look at the first one now, because we have the Director of IT coming tomorrow. Thank you for facilitating the group session for us today, Sarah. How do you feel it went?
I'm pleased I kept to time and the tool kept me focused.
Would anyone else like to offer some positive feedback to Sarah?
Yes, you brought us back to the task in hand.
You tried to use the words we used.
And I felt valued and listened to.
Thanks for that. It's been a really useful meeting.
We have demonstrated how the claims, concerns and issues tool can be used in our meetings to develop an open culture which also celebrates achievements.